Following the September 11th terrorist attacks, the federal government established a hospital preparedness program. It was intended to prepare the nation's medical facilities for an influx of patients in the event of another attack or infectious disease. But the Washington Post reports funding for the program has been in steady decline, leaving the U.S. largely unprepared to face the coronavirus pandemic. Washington Post investigative reporter Jenn Abelson and her colleagues examined this in a new piece in the Post, and Jenn joins me now from Washington. Jenn, thank you very much for being with us. Your piece looked back through the decades for some context that helps explain what we're seeing now regarding hospitals. In your piece, you categorized the government's response to public health emergencies as a boom and bust cycle. What do you mean by that?
Absolutely. So what we saw is after 9/11, there was an infusion of funds that was invested in the nation to try to address preparedness issues. And we saw that over the next 2 decades, with every major health crisis, from H1N1, swine flu, bird flu, and Ebola crisis. But besides those health emergencies, investment, as time faded from those emergencies, investments would wane. Funding plummeted dramatically. There was less interest from Congress in investing in the nation's health system, and we're seeing the consequences of that right now.
So you say there was less interest. I mean, what were those things that were sort of taking away attention? Why did the funding for hospital preparedness actually start to go down after 2004?
Sure. What we saw is in those initial 3 years after 9/11, there was a dramatic increase from 135 million to 515 million. But the problem there was that it was still woefully inadequate. And so even though there was a tremendous increase, that still was a very small drop in the bucket as to what hospitals said they needed in order to be prepared for another terrorist attack or for an infectious disease or other major crises. So as essentially what we heard from a lot of major health officials in the country was that it was just as you got further and further away from the crises of the moment, there were other priorities, other things that were taking time and attention away from Congress. And the hospital system always seemed to be, in the words of one health official, the stepchild, that it always seemed to not get as much attention and funding as was needed.
Well, your report says that between 2001 and 2017, the federal government invested $118 billion on health threats, but less than $6 billion of that went to assisting the nation's network of 6,000 hospitals. Why is that, and where did the rest of that money go?
The rest of that money went to various different types of preparedness efforts. So everything from biodefense, defense funding, efforts to invest in smallpox vaccines and other types of efforts. But when it came to the frontline institutions, the systems and staff that were going to be dealing on the front lines of a crisis like today, they were getting very little funds. By 2018, I think it was, UCSF in San Francisco, they were only getting about $5,000 a year to help with their training, and they'd called that amount laughable, and they ended up pooling resources with a number of different hospitals in the county in order to stretch the funds because it was so little.
So bottom line, ultimately, how is the lack of preparedness funding over the years impacting hospitals during the pandemic right now?
I think we're seeing the consequences. The New Jersey Hospital Health Association, the leader there, they saw funding cut 50% between around 2010 and 2018. And they said that resulted in smaller stockpiles, that resulted in less training. And what you're seeing in New Jersey, which is the second hardest hit state with the highest number of cases and deaths from coronavirus, is that the system is strained. It's entirely overwhelmed. And we talked to hospital administrators in New York who are grappling with this issue, Northern New York, who weren't able to afford the ventilator cost, the replacement cost for the maintenance required. We talked to hospitals in Michigan who couldn't afford to replace expiring N95 masks, and we found that a number of hospitals, they were using these expired N95 respirator masks now because they didn't have the money to replace what they had and received years ago.
Well, it is a really eye-opening report. Jenn Abelson. Jenn, thanks very much for being with us.
Thank you for having me.